So here, this video, I'm going to talk about the difference between panel interviews and MMI interviews. And MMI interviews are mini mixed interviews. That's a whole different set of approach. Some schools don't even do MMI. Some schools only do MMI. Some do a mix of panel and MMI. Panel is essentially where you have anywhere from 3 to 8 people. I had one interview where there were 8 people, and that's fairly intimidating when you walk into a room and there's 8 people there. But essentially, they're behind a desk. They're asking you generic questions such as, tell us yourself, your strengths, weaknesses, why do you want this, blah, 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 blah. Very generic questions. Sometimes you have like left field questions, but you can't really prepare for. But the generic questions you can prepare for. So panel interview is like a standardized interview session that you can actually prepare the most for. Some key things to remember for these panel interviews is 1, address everyone in the panel. If one person asks you a question, don't just look at them. Make sure you're looking around the room and acknowledging everyone that's present there. Make sure you have open body language and you're like looking towards everyone. If someone's asking you a question, face them and then, kind of address the whole room. So some people, I think, just hone in on one person because they ask a question and then just ignore everyone else. So just try to make it a more interactive panel by making sure you acknowledge everyone there. Number 2, for these panel interviews, depending on how long they are, 20 minutes or 30 minutes typically, they'll have a bunch of questions they have to get through. We'll have like 5 to 7 questions minimum. One is like, tell us about yourself. What are your strengths and weaknesses? Why medicine? Or why this residency? Or why this school? Tell us about a cool thing that you did. Tell us about a time you failed, etc., etc. Like these very common questions. So there's going to be like 5 to 7 typically that they have to get through. And so in order to make sure they're able to get through that, keep your answers succinct. When they ask you about tell us yourself, they don't want a 5-minute spiel about it. They want 1 to 2 minutes max of high overarching things. So I'll discuss this in a later section about how to answer these questions, but keep it succinct. That's the main thing. And then the last thing is for a panel interview, it's good because there's 2-way streets. At the end of every panel interview, they're going to say, do you have any questions for us? And if you say no, that's a huge red flag. That's like this person has either no interest in us or did not take care enough or take enough time to prepare and ask us questions. So always ask a question at the end of a panel interview, always. And this is when the preparation will be helpful for you. If you know beforehand what school, what residency, what program you're going to, their strengths and weaknesses, which I talked about earlier, that you can research, then you have very specific questions you can ask them. And trust me, asking these questions in a panel interview is such a good way to stand out. People who've asked very good questions, even if the rest of the panel interview was like average, mediocre, really good questions would be like, that made us think or that made us question it. Really push the person up in terms of their ranking and their performance on that interview. So I think that's probably one of the best things you can do for the panel interview is like coming well equipped with a few questions and then asking these very thoughtful or provocative or, interesting questions. And that's going to help you stand out. For the MMIs, these mixed mini interviews, they're typically like ethical scenarios or medical situations where most of the time role play is involved. It might involve someone pretending to be the mother of a patient, of a kid who has cancer, and you're the doctor, and you got to break the bad news to the mother. How would you do that? And so you like act it out for those minutes. Or it could be an ethical situation where someone's like, you're working with a friend and your friend was caught stealing and you found your friend stealing from the counter. How do you navigate this approach? Or how do you approach the situation? And then there's someone just like sitting there like recording and there's no real role play. It's just you like thinking out loud about how to approach that situation. Sometimes there's medical scenarios as well. Sometimes it's like, this is more for like residency or later on. If they do MMIs, a lot of the residency and fellowship interviews don't do mixed mini interviews. They mainly do panel, which is really good. But sometimes you'll have like medical scenarios, but just be aware that they don't expect you to have medical knowledge. Especially if this is a medical school interview, they don't really expect you to have any medical knowledge. They're more so testing your ability to reason and to think through a problem. So that's the main thing. For ethical scenarios and MMIs, one very important thing to remember is that you have to discuss both sides of the coin. Now, for example, in that scenario where you caught your friend stealing from the counter at the place that you both work, you got to decide what you're going to do in that. Right? The question is going to be, what do you do in the situation? So you can't just come out and say, I'm going to report him to the manager because that's obviously wrong. Well, yeah, duh, like it is wrong. Like that's not the point. The point is to test your reasoning ability. And the way they test that is to see how you answer that question. So the best way to answer that question is to first outline the 2 possible decision points you can take. You can say, okay, I can either talk to my friend and understand why he's stealing and what need he might have and see if I can help him and tell him not to do this again and create a boundary that if he does it again, then I'll report him, blah, 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 blah. That's one approach, like talking to your friend about it first. Or the other approach is like, I go report it directly to the manager because, I'm also an employee there. It's my responsibility to report theft, so that's what I should do. So in these situations, usually there's no clear right or wrong. Sometimes there is like a more right answer or less right answer, but you're not getting judged on whether you pick the right answer or not, unless it's like blatantly wrong. In that case, it'll be obvious, it'll be common sense. The way you're going to be tested on this or judged on this is you are able to outline the 2 or 3 options in front of you. You're able to discuss the pros and cons of each of those decision points. So if you're saying, okay, I'm going to talk to my friend. Okay, the pro is that it'll help strengthen our friendship. It'll get us closer. I'll actually understand why he's doing this, and maybe I could actually help my friend. He might be in a crazy situation. I don't know, like maybe his sister needs like emergent surgery or something, right? So you're actually thinking through that. So you want to say all these stuff out loud. The cons is that I'm losing my integrity towards my work because I'm not reporting a crime, that I'm actually seeing a crime. I may become complicit in the act of stealing because I do know that he's doing that, but I'm not reporting him, and blah, 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 blah. So you list the pros and cons of that decision. And then you say, on the other hand, if I go to the manager, then the cons is that I might lose my friendship. My friend might get fired. He might need money. He's like, saving up for whatever, and he's not going to be able to do that because I know he's my friend. So those are the cons. The pros is that, I'm responsible at work. I report it to my manager, and it's going to prevent future crime. I'm not complicit in it anymore, blah, 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 blah. So each decision, pros, cons. The other decision, pros, cons. And then this is the most important thing. You have to pick a decision at the end. So this is going to be about 7 or 8 minutes in the station. You want to take the first 4 to 5 minutes to outline the ethical scenario, discuss all sides, pros and cons, and then you have to make a decision. So many times I've seen people come through, candidates, that they don't make a decision. They reason it out perfectly. They reason out everything, but they can't decide on what to do. They say, okay, well, this is possible too, but this is possible too. So in this situation, blah, 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 blah. And their whole explaining the time goes up. They don't even decide. Or they just say, well, I'm not sure what I would do in this situation, but I'll just see if it happens again. It's like, okay, but that's not a real answer. So the ultimate conclusion to the scenario is you have to make a decision and then justify why you are making that decision. You can say, I'm actually going to talk to my friend because I value our friendship. He's been there for me in the past. We've been friends for 10 years. You can come up with a lot of stuff. I mean, some of the stories are not going to have everything in there. So whatever you value or how you approach it is what they're going to look for. So you can say, I value my friendship a lot, and maybe he has a real reason for why he's doing this. So I can understand that reason. I can help him out so that he doesn't do this again. And I can also let my manager know, and I'll let my friend know that, hey, I'm going to let my manager know that I noticed this and that we had this conversation, and this, if it happens again, then I'm going to have to escalate it, et cetera, et cetera, et cetera. So there is definitely a way you can combine the two into a middle ground sometimes, but sometimes that's not available. And in the case that it's not available, pick one or the other. And if you don't pick, then it's not a fail in the station because it's like reasoning and decision-making abilities, but it doesn't look good if you can't make a decision. So that's probably the biggest thing I can tell you for MMIs about how to crush an MMI station. And then other things to remember in terms of principles when you're encountering these ethical scenarios is patient autonomy, do no harm, and in complex situations, always say that you will seek additional help. Now, this could be through calling a senior doctor to the scene, calling and attending, calling different specialists and consulting other specialists. Whatever the situation might be, the general principle you want to make sure you talk about is that you're going to seek help. Even as like in my board exams, or we had OSCEs, which are exams in medical school, a key thing is like if someone's crashing, someone's sick or complex, you don't know what's going on, seeking help is actually a check mark. It's like if you don't ask that, that's actually bad, because it shows either that you're not aware that you're out of depth of water, you don't know, you're beyond your capabilities, or that you are just too confident and you'll just make decisions without seeking help, which is again a very bad thing because it relates to the principle of do no harm. So the priorities are patient autonomy, patient's ability to choose for themselves, do no harm, which is something you got to remember. You always have to prioritize safety of the patient and safety of everyone involved. And number 3, always seek help. Say that you'll seek consultation, advice, help, whatever the situation is. And then the last thing before we finish the section about MMIs is I want you to consider each MMI as an individual interview. So commonly I've heard of friends and people who went through MMIs, bombed one MMI station, and then were just feeling so down about it. They didn't even read the prompt or read the prompt wrongly on the second one, and then bombed another one, and then the whole thing just goes downhill. Consider each MMI as a separate interview because it is a separate interview. They're all separate stations. What happens in one station, the other people don't know. So if you screw up one station, that's okay. You'll probably have like 5 to 7 stations. And even if you screw up on 1 or 2, there's still enough other stations to make up for it. So I would just say, if you screw one up, that's fine. Don't carry that negativity onwards to the next station. There was one station where I finished so early, I finished in 4 minutes. And it was an 8-minute station. And I was just sitting there awkwardly, like looking at the person who was like marking me. And I was just like, And then I was like, should I say something? There's no way I finished the station in half the time. There's gotta be something I'm missing. And I was like panicking as I'm sitting there because I was like, well, maybe I need to say something. And then I tried to say something additionally. And then they're like, oh, okay, sure. And then they were just noting something down. I was like, and then I was panicking even more. I was like, okay, is this am I messing up? And so when I left the room, I remember thinking, oh my God, I'm sure I bombed that. I think I missed a few things, but you have 2 minutes before you read the prompt and start the next one. I remember going to the next door and I was like, all right, I got to clear my mind. I can't think of what happened. It's done. I'm out of there. This is the new one. And so that's the mindset and the approach you want to take for MMIs, because you have 8 individual interviews, which is awesome. And so if you screw up one, it's not a big deal. You'll still come out winning, hopefully, if you crush the rest of the interviews.